Hello and a warm welcome to Braintainment, where we make the complex simple and the boring exciting. In this space, we unwrap the mysteries of the universe with a special focus on the fascinating fields of health and medicine. From the intricate workings of the human brain to the microscopic world of cells and bacteria, we seek to illuminate the wonders of the world within us. Today, we're setting our sights on a particular medical condition that has puzzled and intrigued doctors for centuries, a condition that affects thousands each year, often sneaking up without warning. That condition is appendicitis. Our journey today will take us deep into the human body, where we'll uncover the truth about this common yet misunderstood condition. We'll explore what it is, how it affects us, and most importantly, what we can do about it. So buckle up for a journey into the fascinating world of medicine. To understand appendicitis, we first need to know what the appendix is. The appendix is a small tube-like organ attached to the first part of the large intestine, also known as the colon. It's located in the lower right portion of the abdomen. Now, the exact function of this little organ is still a topic of debate among medical professionals. Some suggest it plays a role in maintaining good gut bacteria, while others believe it to be a vestigial organ, a remnant from our evolutionary past with no current function. But let's delve into the main topic of our discussion, appendicitis. Essentially, appendicitis is what happens when the appendix becomes inflamed. This inflammation is typically caused by an infection. Imagine, if you will, a small blockage occurring in the lining of the appendix. This blockage can be due to accumulated waste material or, in some cases, a hard piece of stool that gets trapped. When such a blockage occurs, bacteria within the appendix begin to multiply. This rapid multiplication of bacteria can lead to the formation of pus, causing the appendix to swell. This swelling and subsequent inflammation is what we refer to as appendicitis. The situation can become dire if the swollen appendix is left untreated. In such a case, it can eventually burst or rupture, spreading the infection to the surrounding areas. This can lead to a more severe condition known as peritonitis, which is an inflammation of the lining of the abdominal cavity. It's important to note that appendicitis isn't a condition that develops over a long period of time. Instead, it's an acute condition, meaning it comes on suddenly, often causing severe pain that necessitates immediate medical attention. So, in a nutshell, appendicitis is an inflammation of the appendix, usually due to an infection. It's a sudden and severe condition that demands prompt medical intervention to prevent further complications such as a ruptured appendix and peritonitis. In our next segment, we'll delve into the signs and symptoms of appendicitis, so stay tuned. Now that we know what appendicitis is, how do we recognize it? What are the signs and symptoms? One of the most common symptoms of appendicitis is a sharp pain that begins around your navel and often shifts to your lower right abdomen. This pain typically starts as a dull ache that becomes increasingly severe, especially when you move around, take deep breaths, cough, or sneeze. Next, you might experience loss of appetite. As appendicitis progresses, this could escalate into nausea and even vomiting. These symptoms are often mistaken for a stomach bug, but they tend to linger and intensify, unlike a typical stomach upset that usually resolves within 24 hours. Accompanying these symptoms, you might also develop a low-grade fever that gradually increases over time. This is your body's response to the inflammation in your appendix. Other symptoms may include constipation or diarrhea, abdominal bloating, and a general feeling of malaise or discomfort. And these symptoms are not exclusive to appendicitis and can be associated with other gastrointestinal conditions as well. It's important to note that not everyone will experience all these symptoms. Some people may only have one or two, while others might have several. The presentation of symptoms can also vary depending on factors such as age and the position of the appendix in the body. For example, pregnant women might experience pain in the upper abdomen instead of the lower right side due to the shifting of organs. In children and elderly people, the symptoms might be less specific and harder to pinpoint, which can sometimes delay diagnosis. Children might complain of a tummy ache, while elderly people might just feel generally unwell. Remember, these symptoms can also be signs of other conditions. It's always best to seek medical advice if you're not feeling well. Appendicitis is a serious condition that requires immediate medical attention. If left untreated, it can lead to severe complications like a ruptured appendix, which can be life-threatening. So listen to your body and don't hesitate to seek help if something doesn't feel right. Now, you might be wondering, what causes appendicitis, and am I at risk? Well, appendicitis occurs when the appendix, a small pouch attached to your large intestine, becomes inflamed. This inflammation is often due to a blockage of the appendix's inner lining. This blockage can be caused by various factors, such as a buildup of feces, a foreign body, or in rare cases, a tumor. Once the appendix is blocked, bacteria which are normally present in the appendix begin to multiply. This leads to the formation of pus, which further inflames and swells the appendix, causing intense pain. If not addressed promptly, this can lead to complications such as a ruptured appendix, which can be life-threatening. Now, let's talk about risk factors. Appendicitis can affect anyone, regardless of age or gender. However, it is more common in people between the ages of 10 and 30 years old. Why? Well, this is possibly because young people's immune systems are still developing, making them more susceptible to infections. Family history also plays a role. If you have a family member who has had appendicitis, you may be at a higher risk. This suggests a possible genetic predisposition to the condition. Another risk factor worth mentioning is having a history of gastrointestinal diseases. Conditions such as Crohn's disease or ulcerative colitis can increase your chances of developing appendicitis. Furthermore, a diet low in fiber and high in processed foods may contribute to the risk. A diet rich in fiber helps keep your digestive system healthy and reduces the chance of fecal matter becoming lodged in the appendix. Lastly, certain infections like gastrointestinal viruses can also lead to appendicitis by causing swelling of lymph nodes in the wall of the appendix. In summary, while appendicitis can be caused by a variety of factors, it is more likely to occur in younger individuals, those with a family history or certain gastrointestinal conditions, and those with a diet low in fiber. So, while anyone can get appendicitis, certain factors can increase your risk. So, we've identified what appendicitis is, its symptoms, causes, and risk factors. But how do we treat it? And can we prevent it? When it comes to treating appendicitis, the most common route is surgical removal of the appendix, a procedure known as an appendectomy. This is usually done as a laparoscopic surgery, a minimally invasive procedure. A surgeon makes small incisions in your abdomen and inserts long, thin surgical instruments. The surgeon watches a video screen to guide the tools to remove your appendix. In some cases, an open surgery may be required, especially if the appendix has ruptured and infection has spread beyond the appendix, or if you have an abscess. The surgery generally takes 1 to 2 hours, and with successful treatment, most patients can go home within 24 to 48 hours. However, if the appendix has burst, the recovery process can take longer. Long-term complications are rare, and most people recover fully. Now, you might be wondering, can we prevent appendicitis? Unfortunately, the answer isn't as clear-cut. Given that the causes of appendicitis are often out of our control, such as a blockage due to a foreign body or infection, prevention can be challenging. However, maintaining a healthy lifestyle is always a good idea. This includes a balanced diet, rich in fruits, vegetables, and high-fiber foods, regular exercise, and good hygiene practices like washing hands thoroughly to prevent infections. While these measures won't definitively prevent appendicitis, they can contribute to your overall well-being and strengthen your body's ability to fight off potential infections. Importantly, if you suspect you or someone else may have appendicitis, don't hesitate to seek medical attention. The condition can escalate quickly, and it's important to catch it early. Remember, early diagnosis and treatment are key in managing appendicitis. We've come to the end of our journey into the world of appendicitis. Throughout this enlightening exploration, we've defined appendicitis, delved into its symptoms, and examined its causes and risk factors. We've also discussed the various treatments available and the preventative measures one can take. Remember, the key to battling appendicitis, as with many health conditions, is early detection and swift action. Never trivialize persistent abdominal pain or other suspicious symptoms. When in doubt, always seek professional medical advice. The world of medicine is vast and ever-evolving, and we've only scratched the surface with appendicitis. There's so much more to learn, to question, and to discover. Thank you for joining us on Braintainment. If you found this video helpful, don't forget to give us a thumbs up and hit that subscribe button for more enlightening content. Until next time, stay curious and keep learning.